So thank you very much, Ole. Thank you very much, the ERAS Society, for giving me the chance to talk about sustainability. Perhaps I have to explain what is sustainability. Because the first time I heard about sustainability was in a different forum, in a forum about the planet, a forum about resources, water, gas, petrol, and something like that, and saying, okay. So taking this sustainability to ERAS society is because, it's good. It's good talking about the planet because we have our planet, the ERAS world. So we have created our planet, our world. You see, the planet is just the best for the patients for the very beginning, the best before, during, and after surgery. This is our planet, our ERAS planet. And our planet, if you allow me to have the planet got different countries, different factors influencing all of this planet, the ERAS one. So perhaps in this context, doing something new, improvement, is we can select which is the best definition for sustainability. The best definition, perhaps, Roger, 2005, the degree to which an innovation continues to be used after initial efforts to secure adoption is completed. Or perhaps, when new ways of working and improved outcomes become the norm. I prefer the second one, just new ways of working and improved outcomes is the norm. Listen, all of us working in healthcare now have the message. Today, we have an imperative to increase quality, improve patient experience, and reduce cost. This is the point why we are talking about sustainability in ERAS, because ERAS we have an imperative to implement ERAS. So, to any implementation, there are different steps. 1, 2, 3, 4, 5 different steps. From knowledge, decisions, to implementation. So if you want to implement anything, you have to understand which one is the best step and how to fulfill all the steps. It's difficult, very difficult to get to implementation. So starting an improvement is not guarantee that it will continue. In fact, from the National Health Service, just 1/3 of any implemented protocol, at last, is, during on the time, is maintaining during the time. 1/3. We got these wonderful documents showing us where the problems are. It's two concepts. Island of improvement effect. The island of improvement effect. It's a lack of spread. And the improvement evaporation effect. It's about sustainability. Island. You want to implement something new, you are wishing to everybody around you, as fast as possible, to get the protocol. But there is a curve, the Rogers curve. Very few people, 2.5 people are enthusiastic. A little bit more are early adopters. But if you move around here, lay majority and laggards, it's difficult to bring them to your protocol. Very difficult. So don't be very fast at the very beginning. Think about this. This is the only way to do a good implementation. About sustainability and the improved evaporation or improvement evaporation effect, so lack of sustainability. This is a good paper, it's a book from 2007, telling us where sustainability is. You know how many things are sorry about this. How many things about sustainability? Thousands of factors. This is difficult to maintain anything because you what? Thousands of factors. And they give us an idea. Says, if you want to sustain your protocol, please do these steps. 1, 2, 3, 4, 5 steps. Looking a little bit closer to this step, just have a look at this. The steps are asking us for audit. You have to audit your data. You have to audit your results. Always the same about data. So it is essential to have high-quality data to support practice change. Should include data about compliance as well as outcome measures. Everybody knows. But data? Everybody has data. That's the big problem. Everybody have. But everybody has quality data? That's a big problem. Everybody got quality data? Just what data do you collect? How you collect the data? Are you sure the best data is? This is the filter. And then you will have perhaps quality data. So think sustainability from the very beginning. Sustaining any profound change process requires a fundamental shift in thinking. We need to understand the forces and challenges that impede progress and to develop workable strategies for dealing with this change. 1999. There's a model. National Health Service has a model to support and to help you with sustainability. Designed to use from the very beginning, designed to use at the level, a specific level, and can be used as a diagnostic tool. 3 areas, 10 factors. Areas for process, benefits, credibility, adaptability, effectiveness. Area from the staff involvement, staff behaviors, senior leadership, clinical leadership. Area from organization, fit organization. So the question here is a score system. Score system, 10 factors. So identify the factor level, do score to each factor, add scores to 10 factors, and look at the final of the score. So you will have an idea around your protocol, and you could have the which of the factor are you have to improve in this score system. It's not bad. The problem with this system, this model, is difficult to take outside England. There are different protocols, different stakeholders, and so on. So in United Kingdom, I think is useful, but outside United Kingdom, my consideration, my concerns about this. So if the score is higher than 55, no problem. Your protocol is reason for optimism. Your protocol will be fine. It's below 35, just please concentrate on improve the likelihood of the sustain, and you have to rescore every day. There is a study, a Delphi study from England, say, okay, good, but what about ERAS? And they did a Delphi study. Delphi study, you know, is some questionnaires, some rounds, questionnaire to experts, and experts give you some feedback. Questionnaire about sustainability in this paper, and the feedback from experts in England tells us is, you want to sustain your protocol, your ERAS protocol in colorectal surgery, it's just regular meeting, feedback, positive results, continuing education and audit. This is the first round. All the round together, same. Championship, facilitator, and standard of care. This is what sustains your protocol. But can you measure sustainability? What is the indicator you can use to know if you are doing a good protocol and you sustain your protocol during the time? Well, have a look to the PubMed, Medline, trying to find a good paper. No one. Very few papers from the scientific point of view telling us something about sustainability. Very few people. I just found this one. It's not surgical, it's just all areas of the medicine. Sustainability of new programs and innovation, 2012. Empirical literature recommendation, so difficult to understand. Question about what sustainability is, a lot of term, and absolutely difficult to get any conclusion with the paper about sustainability. Very difficult, few papers. So even the authors say that's a big problem, but they say that it's a big compliance. Compliance is the more difficult in perhaps the great majority of the studies. So compliance could be the best indicator if you want to understand or you want to see how your program is going on. Compliance with the protocol. This study is a protocol study in 2012, trying to compare sustainability from the Netherlands, from Holland, trying to compare sustainability in two different models, two different protocols, one breast cancer and protocol in enhanced recovery, ERAS colorectal surgery. Unfortunately, we have no data, only data, this is the selected median hospital stay, overall protocol, and the compliance, and only data in 2014 for the breast protocol. No, still, I couldn't find the results from the ERAS colorectal data, still without any publication. So from breast, they sustain the protocol in Holland, also as an indicator of the compliance. The compliance was the only indicator that showed us. So what we did in Spain, as you know, our aims in Spain from 2007 was what are our pre-ERAS results, what are our ERAS results, what about compliance and sustainability. So we prepared the hospital, say, okay, we should start working. Identify stakeholders, executive sponsor, audit performance, and regular meetings, okay? We are ready? So our protocol is 14 items, colorectal protocol, 14 items. We have a collecting data audit system. 12 hospitals. First meeting, March. We should start in June. In June, all 12 hospitals had to be ready for including patients in our collecting data, right? What happens? Looking for compliance and sustainability, this, what happened? You see, June, blue. You can see it's blue. You know, you're here at 12 hospital, June. September, red one. Only few were, December. So if we introduce the red line being 75% of compliance of Gustafsson TERAS, that is the best. Only we can use data for only 10 hospitals starting. So we prepare the machine to give data from 10 hospitals. The computer is giving us data only for 10, because the 70% of compliance. December 2008, June 2009, 10 hospitals, 88% of compliance. Good. December 2009, 75% of compliance, same hospital. Then we finished our first study, outcome, 300 patients, finished the study. So the compliance was not very bad. 75% is lower than before, but it's not bad. It's Gustafsson rules, so more than 75% for the compliance. It's not bad. What happened 1 year later? Well, surprise. 1 year later, in December 2010, 90% of compliance. Shock, right? This is wonderful data. It's a wonderful data. Oh, I forgot one thing. You must remember. We prepared the machine to give data for those hospitals who were more than 75% of compliance. So the problem was that we have only 6 hospitals fulfilling this data and collecting data only for 6 hospitals. Half of the hospital, the very beginning, the 12 of them. Knockout. Where are the problems? Okay, look again, our system are collecting data, problems, where are the problems? 2 different scenarios. One, no implementation at all. Hospital, it's very difficult for some hospitals to implement, and even they say they have a fast track or ERAS protocol. Never. Complaints is enough, is good enough. A weak implementation. This is in the first wall, all the protocol come down. The first barrier, all the protocol come down. So please think about this. Creating a good implementation. Problems. Lack of an adequate team. Organizational issues. No ERAS facilitator. Leadership fails. Big problems. That's happening in Spain. So, please, take home some message. Changing clinical practice is not a simple task. Sustainability means holding the gains, evolving as required, and not going back, no step back to the old ways. Sustainability is the result of effective implementation. ERAS implementation will only succeed if sustainability is planned from start. All stakeholders have to be included. Identify and include. And that means sometimes you have to understand your system, your national health system. It's not the same in England, not the same in German, not the same in French. Understand which are your stakeholders in your national system. Identify them and then include them in your plan. Team meeting, mandatory, regular team meeting. And get high quality data to audit outcome and compliance.